Cool. So I'm Ale, I'm one of the founders of Even, and we want to build the best health cover in India. That's the simple mission. So we want to be better than any insurance cover, any sort of practice subscription, or the hospital subscription. We want to give a one-stop solution that covers you from doctor consultations, lab tests, hospitalizations, medical counseling, second opinions, psychologists, everything together, right? And we want to do that end to end. So partnering with the best hospitals in India, as well as having our own doctors to have a different model of medicine and healthcare that is more outcome oriented rather than profit oriented. So one of the things that we've already done is that here in Bangalore, we've gone live a couple of weeks ago, and we've created the first completely cashless outpatient system in India. So that means that in Bangalore, if you go to a Fortis, an Ariana Health, or an Aster hospital, you'll be able, if you're an Even member, to just scan a QR code, verify your identity with an OTP, and get whatever kind of service that you need completely cashless, without having to first, pay for it, then getting reimbursed, having to file a lot of claims and certify your self-attest your bills and so on. And we have members that are already using that service. That's sort of the first integration that we've done. We're proving it out here in Bangalore. And in the long run, we basically want to change the way that healthcare works right now, where there's a lot of mistrust, both on the side of the hospitals that are often doing a lot of overtreatment and overcharging, as well as insurers that are often denying claims. So in the Even model, we would have our own doctors, as well as some selected partnerships with hospitals that are incentivized to keep people healthy. In fact, because they're encouraged to manage people's health, they're going to be making more money if people are healthy because they get a fixed percentage of our subscription. So the user pays us a subscription, and then a part of the money gets kept by Even for the management and for our own doctors, and the rest goes to the hospitals themselves. And so right now we're looking especially on the tech side for React and React Native engineers. And we're not looking for somebody that specifically has a background in healthcare. In fact, most of our team doesn't. We have a couple of people that have a long-standing experience in either insurance or in healthcare, but we are actually keen to bring a much more tech-friendly and digitally oriented, model perspective to healthcare. So we want simply the best engineers. You don't need to have worked in healthcare before. And I am actually in office. We're actually not really, we allow people to work remotely, but we do think that especially for an early stage startup, there's a lot of value in having a nice office where people can come together. So I'm just going to show you quickly. This is the office that we have in Defense Colony in Daranagar on 6th Main. I'm not sure how much detail I should show you, but there's some meeting rooms here, some plants. And we're soon going to be expanding the office as well. It's in a really nice location in Daranagar, close to a lot of restaurants and bars, and all the team that's around here. So yeah, that's what I'll say for now. But yeah, happy to answer any questions later on. If you wanted to be completely remote, 100% remote.
Yeah, completely 100%.
For me, no. Unfortunately, that's not something that maybe in a few years' time, but not right now. It's a good question. I would say we have a pretty streamlined development process, at least right now, because we're a small team. We don't get bogged down into a lot of cleaning of Jira boards and ticketing and stuff like that. We have a code review cycle, a pretty streamlined deployment pipeline, and we try to deploy to production quite frequently, sometimes even multiple times a day. And so I would say, yeah, it's kind of the streamlined development process that doesn't add a lot of overhead, as well as being able to push changes frequently and seeing that you're making a difference to the users that we're serving on a regular basis. we haven't had anybody leave, so hopefully there's not too many things that people find unpleasant. If I had to speculate, I'd probably say that maybe sometimes people might feel like having a bit more remote work is necessary, but I've never said no to anybody that wanted to work remotely, just to be clear. So it's just something that we make clear from the start that sets the right kind of selection in motion. And then if somebody is in the team and they want to work remotely even for a month and they have a reason for it, that's fine. So I don't know, I think probably then the main thing is that, to be completely upfront, we do work a lot, right? So we have a lot of very committed people in the team that without having to ever ask, they will work on weekends because they like the work and because they believe in the mission. And, we are building a digital product, but we're also, operation intensive as a business because we're obviously dealing with healthcare and hospitals. And so there's constantly some requests or something to deal with. And we're now building the automation system that will enable us to kind of not have to do a lot of things manually or have to, special case things. But that's in process. And while we're doing that, there's a lot of basically work that needs to go into building the platform and creating a stable system. And it just happens to be the case that, we end up working a lot. So I think this is not special. I think a lot of startups are like that. And I would say, especially in the early stage, we try to find people that believe in the mission and happily work, either because they want to know better, like the tech stack that we work with and want to do research on the weekend into the technology and how to improve it, or because they want to kind of get ahead with the sort of requests that they received. And so it ends up being the case that we work a lot. And I think if it's something that we do it willingly and nobody forces us to. And formally, we don't actually have a cap on the number of holidays that you can take at even. We try to have a very kind of individual empowered culture where people they can use their best judgment and then do as they want, as long as they inform their team members. They can take as many holidays as they want. They can work remotely for as long as they want, if they have reason for it. And basically, it turns out to be the case that at least right now, because it's so exciting that we're live, we see how we're already making an impact on people's lives, that they are able to visit the hospital and get things checked out that they wouldn't normally get checked out because they wouldn't be covered. And so this is already kind of bringing benefits to their health. Everybody's very motivated, and that, maybe the sort of slightly negative side of that is that you end up maybe not having so much time outside of work. So it's kind of up to you whether you see that as a problem or not. But it's good to be honest, because there's things that we've taken a stance on as a company, and that's that we like office culture, and right now we're very mission driven. I guess sticking to the order. So we've actually again taken a bit of a stance on this. From the beginning, we've tried to be very transparent about our compensation structure. In fact, you can find out about that on careers.even.in. And there is we made the levels and the compensation fully available to everybody. It's actually to the point where I think other startups have used it as a benchmark. And we believe one of the first things that I was struck by, I've been working on the idea of Even for over 2 years now, but I moved full-time to India this year in February. And one of the first things that I was struck by when I was hiring for the first time here is that there's a huge variance in salaries, right? And even people with the similar levels of experience and skill will end up getting very different compensation packages. And we think that that's ultimately something that fosters resentment within a team. And so we wanted to be pretty transparent about what the compensation structure was. So we published what our levels would be. This is for tech and non-tech roles. But we published all our levels and what the compensation would be, and we operate on a first and best offer. So we don't negotiate. We make the offer that we think is proportionate to your kind of current expectations and skill level, and we basically stick to that. We think we have a pretty generous compensation package across all levels, and so we haven't had an issue where that was below the expectations of the candidates. And we think that in the long run, this is going to be helpful because then people won't find out that their desk mate is making 10 lakh more than them, even though they do exactly the same job. And so that's obviously, even since February, things have changed a bit and salaries have increased, especially for tech roles. And so we might need to revise the compensation packages at some point, but we will stick to making it, public and transparent. And I think that just makes the initial conversation a little bit more painful, where people expect to negotiate, they expect to get a little bit more, and so on. But then, if you can get past that initial point, if we find that it's a lot easier in the long run, and crucially, I think it filters out people that are just motivated by that kind of negotiation and just fetching that slightly higher offer, right? We are pretty upfront. Even in the beginning, we showed this is what you can expect, and so there's no misalignment of expectations or anything like that. So we found that it can be helpful. Obviously, sometimes it makes it so that people might feel they need to come in at a higher level and so on, and then we have to convince them that they should stick to us. We still give a lot of equity anyway, and then they get promoted if they do well internally. So yeah, that's the framework that we've adopted at Even.
So when you say you have a transparent policy around that, and you have made these figures transparent for tech, non-tech, across all experience levels, and then you also say that you don't negotiate. So as a candidate, can I get the access to this information before even applying to your role? Have you put it
Yeah, absolutely. Even anybody watching right now, as I said, they can go to careers.even.in, and there's a page there that explains a bit about the culture, about even some job openings and so on. And then there's a compensation section that has this. It's literally a table that says, CTC and equity, what you can expect. We've grown a lot. Sorry?
That's a great thing to do, putting this information out and making it public.
Yeah, I think it's a gamble that we took initially. We were told that this will never work in India, and you're being hopelessly naive, but so far so good. And yeah, it's we've grown a bit, so those numbers will probably get revised, and salaries have also grown a bit, so we'll revise them. But when we revise them, it's also because the team has signed off on them, and it'll still be public. For me, I think probably that they're not going to be a good communicator, and that it's going to be difficult to, establish a rapport and really kind of, get to know each other. Yeah, either something to do with the user data or intentional, misuse of the role and so on. Probably height. Yeah, I'm never able to guess the height well, especially after I interview them on the phone and then see them in person. I'm always surprised. But yeah, that's, I don't know, maybe not a very intelligent answer. For me, I mean, this is going to be controversial, but for me, if somebody saw on too much emphasis on work-life balance and too little emphasis into believing in the mission, or like why they think that they would love it, like why even and not something else, right? And all they talk about is work-life balance. That's a big red flag for me. I try to reply to all incoming At least the ones that I receive on email or LinkedIn, I do reply, so it doesn't matter. I guess, not sure if it's really quirky, but I think we're all food buffs. So in the beginning, we had this, even when the team was just like 10 people or so, everybody would like try to outshine each other by bringing some homemade food to the office. And we've got some pretty good cooks. And any occasion that there is, even like, just like sometimes because we're hungry or whatever, order food for everybody. Or if we're staying late, or if we're staying the weekend, or if it's a Friday, we'll just, or if it's somebody's first day, literally like we'll find any excuse so that there's a lot of food at all times being supplied. So I think it's very simple. You should join even if you want to change healthcare in India for the better. And if that mission speaks to you, and you want to work on a modern tech stack, well, you'll have a lot of say, especially since now it's early on, and you take pride in building good, efficient technical systems, then we might be the right place for you.